So tonight we are going to begin in the book of pharmacology. We are going to begin in chapter 15, treatment of diseases of the eye. So in this module, we're learning about the medications that's going to help treat the eye. And so the objective of this chapter includes you learning about the terminology that's associated with the eye, as well as the treatment for glaucoma and other ophthalmic infections. You should also be able to list and categorize medications that's used in the treatment of ophthalmic infections and glaucoma. You should be able to describe the mechanism of action for each class of drugs that's used in the treatment of glaucoma and ophthalmic infections. And you should also be able to identify some significant drug look-alike, sound-alike issues, because there are some medications that look similar, but they do two totally different things. So we're going to go over that in this presentation. And lastly, but definitely not least, you should be able to identify warning labels and precautionary messages that's associated with medications that's used in the treatment of glaucoma and ophthalmic infections. So now that I've gone over the objective for the treatment of the diseases of the eyes, I'm going to first talk about some of the key terms that we're going to review. So when it comes to the therapies for the eyes, some key terms to remember is the cornea, which is the transparent tissue that covers the interior portion of the eye. You also have the lens, which is a flexible and clear tissue that focuses images. You also have the miosis, which is a contraction of the pupil. And then you have the mydriasis, and that's where the pupils dilate. You also have other key terms when it comes to the eyes, the iris, which is the colored part of the eye, which is seen through the cornea, and it consists of smooth muscles that regulate the pupil size. And then you should know anytime you hear the term ophthalmic, that means it's pertaining to the eye. So now that we've gone over some of the key terms that's associated with eyes, we're going to first start with some of the bacterial infections of the eye. So some bacterial infections of the eye would include blepharitis, excuse me. You have conjunctivitis, you have iritis, you have keratitis, you have a sty, and you have uveitis. Now, based on the bacterial infections of the eye, most people might be common with conjunctivitis and a sty. Now, the conjunctivitis is going to be where the conjunctiva is inflamed. And so another word for conjunctivitis is pink eye. Now, a sty is where you would see like a bulging, like a bump on the eye, and it looks very painful. I'm going to try to see if I can actually pull up a picture so you can see an example of what a sty would look like on the eye. You might have a visual understanding, but just in case anyone has never seen a sty before, I want to provide that visual component for you. All right, so let's see the best. Okay, I'll use this as an example. Where did the picture go? Okay, there it goes. So this is an example of what a sty would look like. And it's actually pretty painful. And so as we continue learning about the different bacterial infections of the eye, we'll also learn about some of the medications that's going to help treat it. So let's first start off talking about blepharitis. So with this, you have the interior and the posterior. Now, when it comes to the anterior part of the eye, it's outside of the eyelid, and blepharitis can come and be caused by Staphylococcus bacteria as well as scalp dandruff. According to the posterior, which is the inside of the eyelid. Blepharitis can be caused by the dysfunction of oil glands in the eyelid. Seborrhea and psoriasis, as well as acne rosacea. So these are some causes of that. So some of the symptoms when it comes to blepharitis would include a person experiencing some eye pain or even burning in the eye. They could have some excessive tearing. They can have a feeling that something's in their eye. Their eyes can have some light sensitivities. Their eyes can have some blurred vision. They might even experience some dry eye. And then there could also be some flaky scales on the eyelids or on their lashes. So these would be some common symptoms of the blepharitis. And as we continue learning about different bacterial infections of the eye, you should know anytime that you hear the suffix itis at the end, that represents there being an inflammation of something. So now that we've talked about blepharitis and what it means in its condition and the symptoms of it, we'll next learn about some other bacterial eye infections. So one of them is conjunctivitis, which I share is also known as the pink eye. Conjunctivitis is caused by allergies, a bacteria, or it could be caused by a virus. Some of the symptoms that a person might experience when they have conjunctivitis would include itching, burning, and then teary outflow. It's also contagious when it's of bacterial origin. So that's why people who have conjunctivitis are always encouraged to continuously wash their hands and not touch their eyes. I always share with people, if your eye is itching, try not to touch it with your hands. Try to use your shirt and kind of rub using the inside of the shirt, because that's something that's touched your skin and nothing that has say had any type of debris flying on the shirt. So it's just another way of being cautious. So continuing learning about the bacterial infections of the eye, you have different classes of topical drugs that's used to treat the infections of the eye. So when we talk about different types of drugs, we're talking about different classes. So if there is a bacterial infection, a common drug that's used is antibiotics, but all antibiotics are not the same because they're going to do different things to help treat a bacterial infection. So some of the classes of bacterial medications would include aminoglycosides, sulfonamides, macrolides, quinolones, and anti-infectives plus corticosteroids. So anytime you see the word sulfonamides, which is the second example, you should know the abbreviation for sulfonamides is sulfa, which is spelled SULFA. Now, most people, when you get ready to take their information, say you are a pharmacy technician, and you're accepting a prescription for a patient, you have to ask them their allergy information. Some people might even tell you that they are allergic to sulfa drugs. And so sulfa represents the abbreviation of sulfonamides, just giving that as an example. So now that we've learned some of the classes that would be treating the infections of the eye, we're next going to continue to learn about more bacterial infections of the eye. So one of the bacterial infections of the eye include keratitis, and that's a severe infection of the cornea. Now remember, the cornea is the transparent tissue that covers the interior portion of the eye. So how is keratitis, how is that formed? It might be caused by bacteria or fungi. It's caused by either trauma or immunodeficiency, and it can also be a chronic eye surface disease. So contact lens use can also cause a microbial and fungal keratitis. So soft contact lens wearers Contact lens wearers, especially those who wear, um, especially those who wear contacts overnight, they're at greater risk for an eye infection. So for those people who use contact lenses, they should always take them out before going to sleep because that can cause an infection. So now that we've talked about keratitis, we are next going to learn about some look-alike and sound-alike drugs. So you should know the abbreviation for look-alike, sound-alike drugs is commonly known as SALAD. That's SALAD. It's an acronym for sound-alike, look-alike drugs. So there are some medications that look exactly the same. It might even have the same length of letters, or it might sound similar, or even in packaging, sometimes medication looks familiar. So it's important to pay very close attention to when you are reading a prescription to make sure that you are entering the correct information based on what the prescriber has written. So be aware of the sound-alike, look-alike drugs. So some examples of eye medication that looks similar is Blef-10 and Blefamide. You also have gentamicin and tobramycin, two different drugs to do that does two totally different things. So it's something to be mindful of. And then you also have Tobrex and Tobradex. So when looking at a medication on a prescription, you always want to make sure that you are paying very close attention to make sure that you're choosing the right medication. So as we continue learning about other bacterial infections in the eye, we're going to learn about uveitis. And so there are some parts of that may have the iritis. You have the cyclitis, and then you have the choroiditis, and there are some symptoms that's associated with this. That would include redness. A person may have some blurred vision. They can have some pain, some inflammation, and then also some light sensitivity. And this type of symptom, it might develop suddenly or it could develop over time. And so we know that there are specialists when it comes to the eyes, and you have different specialists. An example of a different specialist would include an optician, which is the person that makes the lenses. If someone is making eyeglasses, you have the optometrist, which is the person that performs the eye examinations, and they can even prescribe certain eye medications. And then you have the ophthalmologist, and these are the doctors who treat major conditions that affect the eye, and they can also perform surgery. So based on based on a visit to the eye doctor known as an ophthalmologist, or if there is something that the optometrist sees, this is something that could also be detected. So we've learned about some bacterial infections when it comes to the eye. We'll next learn about some viral infections of the eye. So one of the viral infections of the eye would include cytomegalovirus retinitis. And so that's where there's an infection in patients who have HIV or AIDS. Having this type of viral infection would have them have decreased vision. It can have them have eye pain. They can have floaters in their eye where their eyes kind of drift. And then they have photoopsia. This particular viral infection may cause hemorrhage, cell death, or even blindness. You also have herpetic eye disease, and this is where the viral infection might be caused by the herpes zoster, which is a viral infection of the eye. A person can also have the herpes simplex keratitis, and some of the symptoms of this particular viral infection may include eye pain, some redness, or some cloudiness of the cornea. Now, most adults throughout the world have been exposed to the megalovirus, and could even harbor some anti-CMV antibodies. Now, the symptoms that's associated specifically with the herpes zoster ophthalmics are swelling and rash, or somebody having sores around their eyes, lids, or their forehead. And some symptoms of the herpes simplex keratitis are excessive tearing, them having some decreased vision, some gritty feeling in the eye, and then they can also be experiencing pain when looking at a bright light. So now that I've talked about some of the viral infections of the eye, we'll next learn about some of the look-alike, sound-alike drugs of viral medication for the eyes. So some of those examples is Veroptic, Vera A, and Tomoptic. All of those are different. They sound similar, but you want to pay very close attention. Other examples might be Natacin and Naproxen. They sound the same and even kind of look the same, but they're two different ones. So the Natacin would be the antibiotic, and Naproxen is actually for pain because it's an analgesic. So remember, when looking at prescriptions and you see the medications written, you want to pay very close attention that you select the right drug when entering the information into the computer database. And always remember, if you are ever unsure of something, I like to use a mantra when it comes to when in doubt, don't. Remember, you can always call a physician's office to verify what has been written so that you make sure that you choose the right thing as a pharmacy technician in a pharmacy setting. So now that we talked about some of the bacterial infections in the eye and some of the viral infections in the eye, we're next going to learn about the fungal and protozoal infections of the eye. So two of those examples would be the Fusarium keratitis, and this occurs in people who could wear soft contact lenses. And then you have toxoplasmosis, and this particular fungal infection of the eye could be transmitted by people eating raw meat and cat feces. And if it's untreated, it could cause blindness. And with the toxoplasmosis, this causes ocular inflammation, and then it could also cause some retinal edema, which is where the eyes could swell. So now that we've learned about those two examples of fungal infections of the eye, we'll continue to learn about other infections of the eye, which includes the Helminthic. And so some examples of that would include cystic cirrhosis and toxocirrhosis as examples. Now, when it comes to onchocerciasis, I hope I'm pronouncing that right. With that one, with the first point, it's the second leading cause of infections of blindness in the world, according to the WHO, which stands for the World Health Organization. Now, dogs are common carriers of the worm that causes toxocariasis, and the infection is contracted by eating soil that is infested with feces that contains the worm eggs, which is the most common in children. So it's really important. That's why a lot of people, when they have, I call them our furry friends or our furry family members, the pets, that they always kind of watch them and where they go so that they're not ingesting anything that's going to be harmful to them. So in us learning about the infections of the eye, we'll continue learning about some of the medications that help treat the viral infections of the eye. So some of the drugs that's used for viral infections of the eye is Cidovovir, Foscarnet, Ganciclovir, and Valganciclovir. I know these sound very funny and probably very hard to even pronounce, but a little treat, or should I say a little tip when looking at medications, anytime you see a drug name that ends in vir, VIR, or maybe it begins with vir, VIR, you can know that it's a viral medication, an antiviral medication. And so there are some generic versions available for the medications that's listed. So that would represent that these medications that's listed are known as the brand name drugs. And so they have generic names that's available. So now that we've gone over some of the examples of the viral infections in the eye, let's continue to learn about some of the drugs that help treat the fungal and protozoal infections of the eye. So some of the drugs that's used to treat the fusarium keratitis would be the natamycin, and some of the drugs that's used to treat the toxoplasmosis would include the sulfa drugs, which remember sulfa represents sulfonamides. And then you have the pyrimethamine. That's two of the drug classes that would treat toxoplasmosis. So in learning about the drugs that help treat the bacterial infections of the eye, the viral infections of the eye, and also the fungal infections of the eye, one of the medications that's going to help treat the helminthic infections of the eye, some of the drugs that's used to treat parasistic infections would include the ivermectin, and then you even have the albendazole. Now, one of the medications, the very last one, the praziquantel, that does not have FDA approval at this time. So that particular drug might even be in clinical trials. But these are just some examples of what would help with the helminthic infection. So now that we've gone over some of the medications that would help treat the viral, the bacterial, and the fungal infections of the eye, we'll next learn about some eye conditions and eye diseases and what causes them. So one of the eye diseases is glaucoma, and this causes progressive damage to the structures in the eye. So the first thing that's lost is the peripheral vision for someone who has glaucoma. Their ability to see images from the sides or the top or the bottom of their eyes is lost. So your peripheral vision, if you put your hands on the side of your face, you can probably see your hands. So that peripheral vision of being able to see that way would be lost, just given a visual simulation of that. So the only thing that remains when a person has glaucoma is their central vision. And the diagnosis is through tonometry. So you should know that glaucoma is the second leading cause of blindness worldwide. And nearly 1/6 of the population with glaucoma develops bilateral blindness. So it's something that, especially when it comes to sight, that people can feel very conscious about, because, you know, if you've been able to see all of your life and then something happens and a person develops glaucoma, that could be very alarming. And so when we deal with patients as healthcare professionals, it's very important that we have empathy and make sure that we are taking our time with each individual because they're all dealing with something different. So continuing learning about different eye diseases, we're going to continue learning about the pathophysiology of the glaucoma. So you have an open angle glaucoma, and this is the most common form of glaucoma. It results from abnormal accumulation of the aqueous humor. And you should know with the aqueous humor, it's the fluid that's found in the anterior chamber of the eye. So it's in front of the lens. And with the glaucoma, it has an increased IOP. IOP stands for intraocular pressure. And with the intraocular pressure, it's the pressure that's exerted by the fluids that's inside of the eyeball. So open angle glaucoma increases the intraocular pressure and it causes degeneration of the optic nerve. So the angle is the opening in the eye where the cornea and the iris meet. And the aqueous fluids is normally drained through this opening. Now, the pathophysiology of the open angle glaucoma is that it has damages to the optic nerve that can occur in the absence of an increased intraocular pressure. So as we learned about the pathophysiology of the open angle glaucoma, we'll continue to learn about the other form of glaucoma, and that's the angle closure. So the angle closure glaucoma is where there is an angle that's inflamed, or the trabecular meshwork angle is obstructed. So with the angle closure glaucoma, that's where the aqueous humor drainage is impaired, so it's not working properly. So there is a sudden increase in eye pressure, and this can cause blindness within a few days if it goes untreated. Now, some of the symptoms of the angle closure glaucoma includes pain and nausea, and if it's treated promptly, permanent vision loss can be avoided. So some people, you just never know what people are going through. So if someone, comes to the pharmacy and they have, eye medication that's going to help, treat the symptoms of their glaucoma, is very important to just be patient and try your best to empathize with each patient. Now, there's a difference when it comes to empathy and sympathy. Empathy expresses the feeling that the patient is not alone. There is a way to help the patient either understand a process of the medication, of how it's being billed, using this from what a pharmacy technician can do. Pharmacy technicians cannot counsel. It's very important to understand that point. However, if a patient has questions about their refills, or if they have no more refills and they need them, there is a certain etiquette that can be taken, and the pharmacy technician can assist with that process and try reaching out to the doctor's office to get that ordered. But it's very important that all pharmacy technicians have empathy when dealing with patients. So continuing learning about the treatment of glaucoma, there are some drugs that can decrease the formation of the aqueous humor, and there are some drugs that promote drainage of the aqueous humor. So you have some medications that accomplishes these effects through their actions on the sympathetic or the parasympathetic nerves that controls the secretion of the fluids, or that promotes the drainage of the fluids. So more than one drug may be used in the treatment of glaucoma. So a person may have more than just one medication that's being used. A person can have multiple. So that's not going to be uncommon if you see that in a pharmacy setting. So now that we've talked about some of the treatment, let's next learn about some of the drugs that helps decrease the aqueous humor formation. So you have different types of drugs. You might have some beta blockers. Beta blockers is a beta adrenergic antagonist. So that's going to be something that blocks the betas from happening. You have the alpha adrenergic agonist, and then you also have the carbonic anhydrase inhibitors. So with the beta adrenergic antagonists, those are used for the treatment of open angle glaucoma. And remember, the open angle glaucoma is the most common form of glaucoma. Now, the carbonic anhydrase inhibitors, those are indicated for the treatment of the open angle glaucoma, and they could also be used for short-term treatment and prevention of the angle closure glaucoma. Just using those for some examples. Continuing to learn about more medications, you have the beta adrenergic antagonists, and these work by inhibiting the actions of the epinephrine or the norepinephrine on the blood vessels in the ciliary body of the eye. Now, the ciliary body, that's the part of the eye that connects to the iris to the cochroid. And as we continue to learn about other drugs that's going to help decrease the aqueous humor, you learn about the alpha adrenergic agonist, and this helps by preventing an increased IOP, which stands for intraocular pressure. The alpha adrenergic agonist is going to work by reducing the blood flow in the ciliary body, and it also reduces the formation of the aqueous humor. It also produces effects that's similar to beta adrenergic antagonists. And there are some adverse reactions that may be systemic or it might be local, and it might include blurred vision, decreased night and distance vision, and it could also have some adverse reactions of dry eyes, irritated eyelids, drowsiness, and headache. So this might be something that a pharmacy technician would actually put a label, an auxiliary label on the medications so that the patient is aware of these adverse reactions. So in continuing to learn about more drugs that help decrease the aqueous humor, we're going to learn about the carbonic anhydrase inhibitor. Now this works by decreasing the intraocular pressure, by decreasing the rate of the production of the aqueous humors. And then you have the carbonic anhydrase, and this is where there is an enzyme that's involved in the conversion of the carbon dioxide as well as the water to bicarbonate. Now with the aqueous humors, they have a production that depends on the transport of the bicarbonate and sodium ions in the ciliary structures. And so you have some common endings for the carbonic anhydrase inhibitors. You may learn as you continue in the course of the pharmacy technician program, there are different stems to medications. So usually anything that ends in zolamide, that is a medication that is and belongs to the carbonic anhydrase inhibitor. So remember, there are different classes of drugs, and that is one of them. So ending with the drugs that help decrease the aqueous humor formation is going to be the adrenergic agonist. And this works by constricting the blood vessels and the ciliary body, and it also decreases the rate of aqueous humor formation. And so one of the drugs that's used is dipavirin, excuse me. Dipavirin is an adrenergic agonist, and it's also a prodrug. So it is inactive until it is metabolized to epinephrine. And then you have other medications that's going to increase the aqueous humor drainage. And these medications is going to include the adrenergic agonist, a cholinergic agonist, and then you have acetylcholinesterase inhibitors and prostaglandin analogs. Now this sounds like a lot, and I know it does, but I want you to know the medications that's prescribed, all medications have a drug class. So it belongs to a category. So these are the classes of drugs that would help increase the aqueous humor drainage. So these are just some examples. Now, the agonist, anytime you hear the word agonist, that means it's going to help bind. And then anytime you hear the word antagonist, that means it's something that's going to block. Just so you kind of get a visual of what's the difference between an agonist and an antagonist. So now that we learned about a few of the drugs that help increase the aqueous humor drainage, we'll next learn about them in specifics. So the cholinergic agonist, that's going to bind to receptors and also mimic the neurotransmitter acetylcholine. Now, when you hear that, you know that inside of your eyes, we also have nerves. So the cholinergic agents is going to help by binding to the receptors and is going to mimic, meaning act like the neurotransmitter acetylcholine. Now, you will learn more about the neurotransmitter acetylcholine as we continue on learning about different body systems, but the abbreviation for acetylcholine is ACH. So continuing learning about cholinergic agonists is going to help by binding the contracts ciliary muscles in the pupil. And remember, when the pupil contracts, that is an example of meiosis. Now, the cholinergic agents is also going to produce a dilation of the trabecular meshwork, and it helps by decreasing the intraocular pressure. Now, when the cholinergic agonist binds, it produces a parasympathetic nervous system that takes effects in the eye. So continuing learning about different drugs that help increase the aqueous humor drainage, we're going to learn about the cholinesterase inhibitor. That works by blocking the enzyme that deactivates the acetylcholine. And it also prolongs the effect of the neurotransmitter acetylcholine. So there are some adverse reactions that might include blurred vision. A person could have a change in near or distance vision. They can have some difficulty in seeing at night or in a dim light. And they might also have some adverse reactions of having a headache, having some twitching of the eyelids, or even having watery eyes. So now that we've learned about the cholinesterase inhibitors, we'll next learn about the prostaglandin analogs. Remember, all of these drugs that you hear me talking about represents a drug class. So the prostaglandin analogs, those work by mimicking the action of a prostaglandin. And the prostaglandin analogs also relaxes the ciliary muscles to permit drainage of the aqueous humors. It also works by dilating the trabecular meshwork to promote drainage. Now, anytime you hear the term prost at the end, P-R-O-S-T, that's another stem of drugs that belong to the drug class prostaglandin analogs. So we learned about the zolamide being at the end, and now we just learned about a drug that if it ends in prost, P-R-O-S-T, it belongs to the prostaglandin analog class. So as we've learned about the different viral infections of the eye, bacterial infections of the eye, fungal infection of the eye, with the medications that's going to increase the aqueous humor drainage, there are some drugs to pay attention to because they do sound alike and look alike. Some examples is lopidine and lodine. Then you have bromonidine and bromocriptine. You have acetazolamide, and then you have acetohexamide. Those really sound similar and even look similar. And then you have isoptocarbachol and isoptocarpine. So it's very important, again, to pay very close attention when it comes to choosing the medications and differentiate them because they can sound similar. So on some medication labels, to avoid a person selecting the wrong drug on the shelf, you will have something that's called tall man lettering. That's where some of the letters in the middle might be taller so that the person who looks at the bottle on the shelf can make the determination to really pay very close attention to the medication that they are picking. So now that we've learned about some of the different eye effects, we're lastly going to talk about some of the warning labels that would be associated with eye medications. So if it comes in a liquid, 9 times out of 10, it's encouraged that on certain suspensions, it should be shaken well. So one example of a drug that should be shaken well would be the betaxolol suspension. It's important that when patients are using eye drops, it's not counseling as a pharmacy technician if you remind them to make sure that they wash their hands before they use the eye drops. There are some warning labels that might be associated, but If not, you can just remind the patient, you make sure that you remember to wash your hands before using the medicine, and that could be like a little reminder. The patient, when taking the eye drops, should avoid touching the tip of the eye drop bottle because that's going to contaminate it. So they want to always avoid contaminating the tip of the bottle. They want to remove their contact lenses before use, and they should wait 15 minutes before reinserting. So sometimes it's been known some people's contact lenses fall out, or maybe they have to wash them, but they should definitely remove their contact lenses before they use them, and then wait 15 minutes before reinserting. Other warning labels to be aware of would be certain medications should be stored at room temperature. It should also be protected from light. So this is why some people might put their medicine in a drawer, because this is also going to protect it from light. It's not encouraged. I know a lot of people are going to think differently about this, but it's really not encouraged to have medicine in the bathroom, even though there is a medicine cabinet in there. The reason why is the moisture. It could change the effect of the drug. And plus, if it's in the bathroom, what if it falls down the sink? There's so many different ways how that can go. So I've seen some people put their medicines on their counters, or some people put their medicines in a drawer. But they should definitely be careful, especially if they have small children around. Also, when it comes to the medication, they should not discontinue it without supervision. So if a patient is prescribed a medication, it's commonly said to them from their doctor's office that they should continue taking the medication until instructed otherwise. Now, there may be some times where a patient may come to you, the pharmacy technician, and may say that they are experiencing some side effects. If that happens, it's very important for them to speak to the pharmacist so that they can be counseled further. Because if they are experiencing some side effects, they might just stop taking the medicine altogether and might not alert anyone. So that is where we as pharmacy technicians need to make sure we are listening closely to see if any patient is having any issues with their medications, so that that information can be brought to the pharmacist's attention. And that is going to complete chapter 15 as we learn about medications for the eyes. I do want to remind you that when it comes to medications, remember to make sure when you are selecting the medication, you're selecting the right one. And in addition to that, when it comes to medications, even though we're talking about medications for the eyes, there are some other eye diseases that a patient could be affected by. That could be detached retina, or they could be experiencing cataracts or macular degeneration. For more examples of eye conditions that a patient may have, or medications that might even be prescribed, there is further research that you can look into. But that's going to conclude chapter 15 as we learned about the diseases and medications that help treat the eye.